Hello, everyone. I will be giving a presentation today on anxiety and does the kind of anxiety really matter when it comes to treating anxiety disorders? My name is Dr. Mallory Inselberg-Andrus. I am a postdoctoral fellow at Restorative Psychological Services. I earned my doctorate degree in clinical psychology from Immaculata University last August, but I have experience working with children and adolescents with anxiety disorders for over 4 years. So some of the main takeaways from today's presentation is going to include number one, although there are many different types of anxiety, the type of anxiety does not matter when it comes to supporting children and adolescents with anxiety. Number two, all anxiety stems from a fear of uncertainty, which can affect how children build connections, interact emotionally and socially, and experience fulfilling and satisfying lives. And number three, we can help you better understand your child's struggles and how to best support them with their anxiety and their emotional or social difficulties. So, what is anxiety? It is something that's very commonly talked about, something very commonly shared with people. It's one of the most common mental health disorders in the United States. Approximately 40 million adults and 6 million children struggle with some form of anxiety. Anxiety can be caused by a variety of factors, which can include a genetic predisposition, so a family history, exposure to traumatic experiences such as abuse, violence, or stress, and then everyday stressors such as work or school. Anxiety can result in physiological responses and changes, so that might look like increased heart rate, restlessness, insomnia. Can also cause significant distress in situations, so that might look like at school, practices, during performances, or even at work. So, how many different kinds of anxiety are actually out there? So, one of the most common forms of anxiety is considered generalized anxiety. So, this involves worry about a variety of issues and situations. It involves feelings of restlessness and tension, difficulty concentrating and irritability, as well as changes in appetite or sleeping patterns. If your child or adolescent is struggling with generalized anxiety, you might hear several things from them. They might be talking about how worried they are about what's going to happen. They might struggle to understand that if they do something today, it might not necessarily affect them tomorrow, but they have that persistent worry that if they screw up now, then it's going to screw up things for them later on. Another really common form of anxiety is social anxiety. So that involves worry about being watched or criticized by others. This often includes a fear of judgment or rejection based on how they may do things, such as how they talk, how they look, and it can make it hard to create friendships and to gain new experiences. So, if your child or adolescent is struggling with social anxiety, you might hear them say very negative thoughts about themselves. So, for example, that might look like, my friends think I'm dumb, I can't do this, or my classmates will make fun of me, I can't wear this, or they'll think I look weird. It's a lot of statements about what they might do and the impression or opinion of others and how that affects how they're feeling about themselves. Another anxiety disorder is panic disorder. So that involves sudden attacks of panic or fear. You might experience symptoms of shortness of breath, tightening of the chest or muscles, or intense sweating. Onset may occur when exposed to a triggering situation or experience. So if your child or adolescent is struggling with panic, they might describe things like they feel like they can't breathe, they need to get out of certain situations, they need to avoid going certain places or being with certain people. And it's this constant fear of their panic coming on in certain situations. Another common form of anxiety are phobias, and this is really any fear of an object or situation. So, individuals may experience symptoms that cause avoidance of such objects or situations. This typically causes a lot of distress that can affect day to day functioning, as well as forming friendships and building new experiences. If your child or adolescent is struggling with a specific phobia, they might say things like, I can't go there because a dog will attack me, if that's something that they're fearing in the moment. Other common ones might be a fear of heights or a fear of insects, and you might just generally hear things about how they're feeling worried about coming into contact with these objects or situations. Another form of anxiety is obsessive compulsive disorder, or known as OCD. So, this experience of intrusive and unwanted thoughts or images, which is obsessions, and the need to engage in behaviors to minimize the distress caused from these obsessions, which are the compulsions. So it's a two-part diagnosis with both obsessions and compulsions occurring at the same time. If your child is struggling with OCD, you might hear from them that they have to clean their hands 10 times a day, or they'll get sick, or that they have to walk in and out of room 3 times, or something bad will happen to them or to their family. It's a lot of concerns regarding their safety, other safety, or things that might not make sense to you, but something that they're internally struggling with. Another form of anxiety is post traumatic stress disorder, or referred to as PTSD. This typically develops in response to a threatening or terrifying situation, either by witnessing it or experiencing it themselves. This often includes flashbacks, intrusive thoughts, and intense distress in reminders of the event. So, if your child is struggling with PTSD, you might hear them say, I don't want to ride in the car because I'm afraid of getting into an accident again. So, if your child's been in a car accident, they might be afraid to repeat that situation again and again for fear of the same outcome. So, does it really matter what kind of anxiety you have? We just talked about all the different kinds of anxieties. So, most people are familiar with the classification system of mental health disorders, which determines whether a person meets criteria for a particular disorder or not. However, by following this sort of system, it suggests that a person only fits into one category and that their symptoms do not overlap with other symptoms of another disorder, which we know to not always be true. Sometimes things happen simultaneously, and you can have two distinct disorders happening at the same time. When children struggle with anxiety, oftentimes their behavior changes, which may be reflective of feelings or experiences that have not been shared with you or even understood by them yet. Therefore, we encourage parents to consider mental health concerns as transdiagnostic. So your child's struggles are more complex than what can be observed on the surface. And more often than not, what we see face to face with a child might not fully explain the full picture of what's going on for them. The kind of anxiety and how your child shows anxiety does not necessarily matter as much as what is causing their distress and how they're feeling about it and making sense of it. Children with a variety of anxiety disorders struggle to build connections, interact emotionally and socially with others, and struggle to experience a fulfilling and satisfying life. So, by looking at what is causing this anxiety, we can do a variety of things. We can assist children in creating lives rich in experience, relationships, and meaning. And we can also assist parents in understanding and helping their children become independent, expressive, and strong people. Through parent training, you will learn how to understand the connection between the foundation of your child's anxiety with the consequences of your child's symptomatology on their feelings and their functioning. So, this is how we approach and understand anxiety. So, all anxiety stems from a difficulty to tolerate uncertainty. And this could look like a variety of different things based on the disorder that the child might be struggling with. So, for example, in generalized anxiety, there might be this fear of uncertainty related to the life or the future. In social anxiety, there might be this uncertainty about what will happen in a certain interaction or in a specific situation. For OCD, the uncertainty might be about the consequence of something not happening as it should. And in PTSD, this might be an uncertainty about safety. So, overall, all of these disorders might be distinct, but there's this underlying core mechanism. It's this fear of uncertainty and this difficulty to tolerate something that might not make sense to your child. This uncertainty can create feelings of distress and can inhibit functioning in many ways, such as academically, emotionally, and socially. When your child experiences high levels of distress, they can respond to situations through a variety of different behaviors. One of the most common ones is avoidance. So, purposely avoiding a situation because it causes anxiety. So, in a sense, they're escaping the anxiety. They might also engage in distraction, so pushing the anxiety and the thoughts away, so refusing to talk about it, refusing to acknowledge something that does cause them anxiety. And then they might also engage in rumination, which is constantly thinking and overthinking the anxiety. This is probably one of the most common ways that children might express their anxiety is through this thinking and overthinking. As a result of all these reactions, your child can feel less confident handling activities, friends, or school, and can experience less happiness, fulfillment, and success in their day to day lives. So, how do we identify the signs of anxiety? Anxiety can manifest in a variety of different ways, but the most common sign is typically when someone physiologically reacts to a situation. So, your child might appear with an increased heart rate, a new stomach ache, opening or clasping their hands, bouncing or shaking their leg. So, an overall level of restlessness or insomnia or fidgeting more often than they typically do. Anxiety can also appear in conversations, so such as how your child talks about themselves or their abilities. So, some examples of this might be if your child or your adolescent says, I can't do this, or I can't handle this, I don't want to try, I'm afraid I'll fail, I don't know what'll happen, or the infamous what if statements. Anxiety can also appear in behaviors, so such as how your child reacts to situations that cause them this anxiety. So your child may do the following things. They might avoid talking to or seeing certain people. They might try to negotiate out of doing things. They might talk or think about situations over and over again. They might ask you for your opinion on things, but do not accept your opinion. They constantly seek reassurance from you that they're okay or that other people in their lives are okay. So, some of the goals of anxiety treatment and parent training sessions. So, with anxiety treatment, we approach things very collaboratively with children and adolescents, and we work on a variety of things. We work on identifying the sources of anxiety and typical responses to anxious thoughts and feelings. Once we identify these anxious thoughts and feelings, we are then able to explore underlying reasons for why these specific triggers are challenging for the child or adolescent. And then we work to change how that child or adolescent views and feels about these situations. We work simultaneously on learning coping skills while also changing the unhealthy thoughts and feelings about these specific triggers. In conjunction with anxiety treatment for children and adolescents, we do offer parent training sessions, which are some of the most helpful and important parts of treatment for children and adolescents. In this process, children are best supported by a network of people, and at the forefront of this network are parents, guardians, caregivers, the people that know your child and your adolescent the best. You will learn how to improve your relationship with your child and to more effectively and supportively communicate with them. And it can be hard managing your own personal and professional lives, as well as handle your child's difficulties. So, this is an opportunity where we will provide you with the space to discuss these challenges and learn strategies to balance everything. There are several ways to help your child struggling with anxiety. Since it does not matter the kind of anxiety that they're struggling with, you can help them think about and experience their anxiety differently. Number one of the biggest parts of this includes validation. Everybody needs and loves validation. Validation for your child's experience with anxiety is so important. All anxieties look different and are unique. So, receiving compassion and understanding can be a positive experience for your child and your adolescent. And it will also help to strengthen the relationship between you two. It is also important to be aware of how your child speaks about their anxiety. If your child lacks confidence in a situation, remind them of their ability to handle whatever happens to them and the fact that you will always be there to support them through any difficult situations. Another important area is to notice how you engage with your child's anxiety. So, if your child seeks reassurance from you often, offering that reassurance can sometimes enable and even reinforce their anxiety. So, being mindful of how you're interacting with your child and the things that you're confirming or not confirming for them will be helpful. Additionally, remind your child of their anxiety management skills. They'll learn a lot of those throughout treatment, so reminding them of using those skills is going to be really important and helpful for them. During times of high stress, it can be really difficult for children and adolescents to remember their skills. So support them with applying these skills in the moment. Have them teach you what their skills are so you're better able to support them in moments where they need to apply these. Below are some skills to use with your child when you notice them anxious. So these are some very common strategies that are often introduced in anxiety treatment as well as encouraged in parent sessions. So one of them is to remind them of how strong they are and that they can handle the situation. This will help to improve their confidence. think about what is likely to happen rather than what their anxiety is telling them about. More often than not, our anxiety are just thoughts. It tells us what can happen in a situation. It doesn't necessarily tell us what will happen. So, trying to focus on that is really important and helpful. Take deep breaths, inhaling for a count of 5, holding for a count of 3, and exhaling for a count of 5. These numbers can be changed based on how fast you want to engage in this. Some people are more comfortable with counts of 3 versus 5, and so on. Counting upwards from 0 to 100 or counting downwards from 100 to 0. This helps distract the child from the challenging situation and the anxiety that they experience. You can help them imagine a place where they feel calm and describe what it looks and feels like. So, engaging their other senses is really going to be helpful and important. Or go for a walk and have your child notice their surroundings, what they might see, what they might hear, what they might smell. This is a really great grounding exercise in helping your child bring themselves back to the present moment. So, these are only a few suggestions on how to support your child. Even if it feels impossible, there's so much parents can do to improve their relationship with their child and help them become successful adults and live fulfilling and satisfying lives. At the end of the day, as all parents, we want to make sure that we're supporting our child the best that we can. And sometimes that just requires us getting a little bit of extra support. Below, I have my contact information. If you're looking to schedule an appointment with your child for anxiety treatment or looking for some extra support as a parent, guardian, or caregiver, please feel free to reach out. I'd be happy to consult with you. Thank you.